Friends, hello everyone. Today we'll do a set of exercises that will help relieve pain caused by a pinched sciatic nerve. It would be great if you have a ball and a resistance band at home. If you don't have any equipment, you can adapt the exercises to suit yourself. The first thing we need to understand is that the sciatic nerve is not pinched by the deep muscle, the piriformis. When our main large gluteal stabilizer muscles aren't working properly, this smaller, deeper muscle will become engaged, and it becomes overstrained, which in turn will irritate the nerve root. To address this, we absolutely need to activate the entire posterior chain. We lie on our back, hold under the knee, flex the foot towards ourselves, and keep the leg straight. My task is to activate the hamstring. I will be bending the leg at the knee. Inhale, bend, exhale. Inhale, exhale. I do this as a warm-up, just to warm up the posterior chain. To make it significantly more challenging, I take a heavy resistance band and slowly perform a bend. Inhale, exhale, inhale, exhale. This way I create resistance as I bend the working knee. I hold the resistance band and bend. Exhale, exhale. You can do these 30 to 40 repetitions within a comfortable range of motion for yourself. Exhale, exhale. If your range of motion doesn't allow you to lift your leg to 90 degrees, lower your leg and work in that position. That's fine too. By the end, it should feel a bit easier, warmer, and the back of your leg should be more warmed up. And we can increase the range of motion. Exhale, exhale, exhale. At the end, our leg is straight. We pull the band toward ourselves and stretch a little more. Relax your leg and breathe. We need the entire back line to activate, all the way up to the lumbar extensors. After this, we can stay on the same side. We hold the band, and from this position, we will lower the leg straight down. We inhale, lower the leg, exhale. Inhale, exhale. Inhale, flex your foot, knees. We don't bend. Breathe in. About 20 repetitions of this will be enough. And at the end, we will also finish with a stretch. We bring our legs a little closer together. And we hold on 10 to 15 seconds. The task in response is to relax. If you feel uncomfortable and tense up in response, the back line will never relax this way. Then lower your leg a bit, relax your foot, and let yourself relax. Good, that's it. Now we'll do it on the other side. One option is to simply hold your leg at first, bend yourself, and warm up. The more repetitions you do, the better. Exhale. Good. Next, we do it with the resistance band. Inhale slowly, exhale. Inhale and exhale. Good. The leg is straight, the foot is flexed toward you. Take the resistance band and stretch the back line. After that, hold with your hands. Inhale, lower the leg, exhale, inhale, exhale. It's also important to engage your abdominal muscles in this position. Our abs work as a stabilizer. If you feel it's difficult to keep your back on the floor, then in this position you should bend the leg that isn't working. We tilt the pelvis toward ourselves and engage the abs. And we work in this position. It will be easier for you to stabilize your torso. Exhale, inhale, exhale. Exhale. If it hurts only on one side, that's more common because there are certain physiological changes. There is an imbalance in the body that provokes pain and tension on one side. We start working on the painful side in order to fully assess the movement and give the body, set the range of motion. But we always do it on the other side as well. We need to establish symmetrical work. Good, that's it. Then at the end, we also pull the foot towards ourselves. Hold it and breathe. Hold for about 15 seconds. If you can move it further, move it a little more. And hold it the same way. Good. Next, we need a ball. We lie down on our back. My pelvis is slightly tucked, still relaxed. My back is pressed down as much as possible while I'm holding the ball between my knees. My task now is to activate the inner thigh. The thigh, and gently I do it. Exhale, exhale. And with these pulsing movements, my task is to squeeze the ball as if compressing it. Exhale. And this way all the tension from this piriformis muscle, which irritates the nerve, we transfer it to another muscle. We need the inner thigh, the back of the thigh, and the front of the thigh to work. There are quite a few large muscles that need to be engaged. That's why we load them. Exhale, exhale. I do it until I get a really nice feeling of warmth. Doing it 40 to 50 times will be great. At the same time, I tense my abs and keep my pelvis tucked in. Ran out. Good. For the last one, I hold it as much as I can. 5, 4, 3, 2, 1. Okay. After this, I activate the front line a bit more. I squeeze the ball in one motion, stretch out while holding it, and we'll do abdominal crunches. The movements are quite small. I only need to lift my shoulder blades off the ground. I slowly inhale, exhale, and inhale again. My elbows are pointing to the sides and my chin is up. Don't pull towards your chest. Good. All right, it would be good to do for 2 repetitions. Squeeze the ball, then do the crunch. Rest for a minute and do the same again. Squeeze the ball about 50 times, 20 times for crunches. It's important that when we do abdominal exercises, we don't feel it in our back. If you feel it in your back towards the end, it means you're doing too much for your body right now. Take shorter breaks and repeat again. All right, and now we'll do this stretch. I sit in a position where my knee is facing forward. The other leg also comes forward, turned outward. This exercise adds mobility to the hip joint. One hand is for support and I keep my other hand on my thigh. Rotate the pelvis inward, then outward. Inward, then outward. We do it in a very calm, comfortable range of motion. We're simply creating mobility. We are rotating the hip joint relative to the thigh. You should feel a stretch. The hip flexor in front is bent. First I'll stretch like this, then it will get a bit stronger. Here, my knee is not straightened. It's just calmly bent in a comfortable position. 2. One more time. Good. Next, from this position, I turn around. With my foot, I move to the side here. The back leg straight on the tiptoe. When I lower myself down, exhaling. And I should feel a stretch in the glute of the bent leg. Exhale. Exhale. I do it within a comfortable range of motion for myself. If this movement is too sharp for you, then we lower the leg down. And this kind of stretch will also be enough. If we sit down, return, sat down, returned. The more we bring the foot inward, the more we stretch the glute. Exhale, exhale, exhale. And at the end, you can lower yourself a bit more and hold for about 15 to 20 seconds. Hold. It's important that at this moment you feel comfortable enough to relax. If you tense up, then we are irritating the structures even more. Good. And switch. First, sit down. The knees are facing straight ahead. The hand is fixed, knees on the floor, and the hand on the thigh. I turn the pelvis, then return. Twist, return. I do these 15 to 20 repetitions. I'm warming up. Good. I'm going to turn back. Hands are supporting. The leg is bent. I straighten the knee of the back leg and gradually push myself back. Return. Push. Return. Exhale. Exhale. And I do 3 more. 2, 1. I stay in this position, lower myself onto my elbows, relax my lower back, keep my legs straight, and give myself a second to stretch. Very good. Done? Friends, I recommend doing this routine twice a day. Do it at a pace that's comfortable for you. If you need professional help, please contact our specialists for a consultation. We are available in Ukraine, Warsaw, and Dubai, and you can conveniently book an appointment using the link in our profile bio or in the description below the video.